The chair now recognizes Mr. Luetkemeyer for 5 minutes.
Thank you, Mr. Chairman. One of the words I use to try and discuss this issue, the COVID problem with people, is always perspective. Try and keep in perspective the disease, the solutions, the other things that are out there. And this is why I asked a question a while ago with regards to attention on COVID and the seeming lack of that for a while on the rest of our healthcare needs. Another situation that I think is concerning is, as we open up our schools, one of the things that's, we look at the damage and concern we have for the children's health care, but yet I did a little research on football injuries. We're almost in the same neighborhood with the deaths, not taking into account the other severe and lifetime injuries that are sustained by young men playing football in high school versus the total deaths that would be anticipated from reopening our schools. And I don't see here an outcry about that. So perspective, to me, is something we always need to consider. One of the things that concerns me also is I wish that Admiral Guar was here yet. I asked this question of him last time he was here, and we didn't have enough time to continue our discussion on it with regards to the sort of perverse incentive for the medical folks to claim that somebody died of COVID versus if it's an automobile accident, for instance, as long as you have COVID in your system, you get to claim it as a COVID death, in which means you get to get more money as the attending physician, hospital, whatever. And he acknowledged that the statistics he's getting from the states are overinflated. We found that the governor of Colorado, who is a Democrat, actually did a research on this and found he had to get rid of 12% of the deaths that were recorded in state. Dr. Redfield, would you like to comment on that a little bit about the perverse incentive, and is there an effort to try and do something different in a way that these deaths are recorded so we actually have better records and better numbers, better data to go with?
Thank you, Congressman. I think you're correct in that we've seen this in other disease processes too. Early in the HIV epidemic, somebody may have a heart attack but also have HIV. The hospital would prefer the DRG for HIV because there's greater reimbursement. So I do think there's some reality to that. When it comes to death reporting, though, I mean, ultimately, it's how the physician defines it in the death certificate. In our National Health Statistics group here in Hyattsville, we review all those death certificates. So I think it's probably less operable in the cause of death, although I won't say there are not some cases. I do think, though, when it comes to hospital reimbursement issues for individuals that get discharged, there could be some play in that for sure.
Well, the Admiral certainly acknowledged that last time he was here, so I think that's very concerning.
很快就可以跟朋友再聚，还有家庭聚会、游行、体育盛事和音乐会。为了帮助社区在重回正轨的时候准备就绪，请立即回复2020年人口普查。现在上网花几分钟的时间，即可影响到医疗保健、公共设施和教育在未来10年的发展。立即上2020census.gov 填好问卷，让美国有更美好的明天。事不宜迟，展开未来，即刻上2020census.gov/languages 回复人口普查。